Hi, my name is Dr. Navneet Kumar, consultant spine surgeon at Manipal Hospital, Sarjapur Road. So today we're going to talk a little bit about osteoporosis and osteoporotic vertebral compression fractures. It is a silent condition which affects particularly ladies after their menopause, making their bone softer than normal. So the bone strength is drastically reduced. What we call bone mineral density has drastically dropped in these patients, and they don't particularly put out any symptoms. And such vulnerable groups, when they are doing their day-to-day activities like going to the bathroom or getting up from the chair or even bending down to lift something, their bones can crack. It can get fractured. So the reason why we are talking about this is because though the osteoporotic fractures are very painful, debilitating, contribute to a lot of mortality and morbidity in this elderly population, it is at the end of the day completely preventable. So it basically requires health education to the vulnerable population. It is possible to detect osteoporosis before it actually leads to a compression fracture. So osteoporosis can be very easily detected through a simple scan called a DEXA scan. It takes hardly 5 minutes to complete the scan, and the scan gives us a T-score, and the scoring system will tell us if the patient is actually osteoporotic or osteopenic or is a normal patient. So based on that, the osteoporosis can be treated with multiple pharmacological agents which can improve the bone strength drastically, so that the patient doesn't end up having a fracture from his day-to-day activities. But is the DEXA scan required for everybody? Does every adult in the world require a DEXA scan to diagnose this osteoporosis? No. We need to also know who are the vulnerable groups where we have to target such screening investigations to pick up potential patients of osteoporosis. The number one risk group are the postmenopausal ladies above the age of 50. So they are the ones who are at the top of the list. Second in line are both males and females above the age of 60. Even males above the age of 60 have the same risk of osteoporosis as a postmenopausal woman. The third in line are individuals of any age group who have these following risk factors, such as excessive smoking, chronic alcohol consumption, those who are taking long-term steroid medications for other ailments. So these are all the main risk factor groups, or the groups which are at a higher risk for developing osteoporosis. So we want the patients to be well educated about this, so that you approach the doctor in a timely manner, so that you take the necessary treatment and avoid such complications of osteoporotic fractures. Thank you.